Any kind of chest pain is pretty scary, right? Your mind immediately jumps to the worst case scenario. But what if I told you that not all chest pain means a heart attack? There's another really common cause that can feel just as sharp and intense. And that's what we're going to break down today. Pericarditis, which is basically an inflammation of the sac that surrounds your heart. So to really get a handle on this, let's think of it like this. Picture your heart as a knight. And like any good knight, it has a suit of armor, a special double-layered sac that protects it. It's a perfect fit, and there's even a little bit of fluid in there so everything can move nice and smoothly. But what happens when that armor gets irritated, when it gets inflamed? Well, that's exactly what pericarditis is. It's when that protective sac, which is called the pericardium, gets inflamed. Now, normally, that space has just a tiny bit of fluid. We're talking maybe 15 to 50 milliliters. That's like a shot glass worth, just enough to keep things lubricated. But when inflammation kicks in, well, the whole game changes.
Okay, so that's the what. But what's really going on inside? What's happening on a mechanical level when this protective layer gets all fired up? Let's get into it.
All right, so here's the key thing to understand. That outer layer of the heart's armor, it's absolutely packed with nerves. Your heart muscle itself doesn't really feel pain, but this outer sac sure does. So when it gets inflamed, those nerves just go haywire, firing off pain signals left and right. And that is what causes that classic super sharp chest pain that, understandably, sends a lot of people straight to the ER. Okay, so the armor's inflamed, we get it, but why? What's causing all this irritation in the first place? Let's round up the usual suspects. So take a look at this. The first thing that probably jumps out at you is that enormous chunk of the chart, up to 90%, labeled idiopathic or viral. Now, idiopathic is just a fancy medical term for we don't know the exact cause. So in the vast majority of cases, they can't find a specific culprit. The general thinking, though, is that most of these are probably triggered by some kind of virus that your body just has to fight off. And when they can actually pin it on an infection, it's usually one of these guys. You've got common viruses like Coxsackie viruses and adenoviruses. More recently, of course, COVID-19 has been shown to be a trigger. And it's also worth noting that in many parts of the developing world, tuberculosis is actually a really significant cause of this condition. But it's not always about catching a bug. Sometimes, believe it or not, the body kind of does this to itself. For example, it can pop up as a delayed reaction after a heart attack. That's called Dressler syndrome. Or it can be tied to autoimmune conditions like lupus or rheumatoid arthritis, where your own immune system gets confused and starts attacking the pericardium. Even metabolic problems like uremia from kidney failure can set it off. All right, so we've covered what it is and what can cause it, but now for the big question. If you're a doctor, how in the world do you tell this apart from something way more serious, like a heart attack? This is where the real detective work comes in.
And this chart here really lays out the key differences. A heart attack is usually described as this crushing, heavy pressure, and it gets worse if you try to do anything. Pericarditis, on the other hand, is sharp, it's stabbing. And here's the kicker. It gets worse when you breathe in deep or lie down, but, and this is so important, it gets better if you sit up and lean forward. That simple change in posture is a massive, massive clue for doctors. Then there's this other classic sign, something a doctor can actually hear with a stethoscope. It's called a pericardial friction rub. It's this really unique, scratchy sound. People say it sounds like two pieces of leather rubbing together. And what's causing it? It's literally the inflamed layers of that sac scraping against each other every time the heart beats. Now, you don't hear it in every case, but when a doctor does hear it, it's a huge tip-off. So to nail down the diagnosis, doctors basically use this simple 2 out of 4 rule. They're looking for at least 2 of these 4 things. 1, that typical sharp chest pain that gets better when you lean forward. 2, hearing that friction rub we just talked about. 3, seeing some very specific changes on an ECG. And 4, finding new or worsening fluid around the heart on an ultrasound. Get 2 of those, and you've got your diagnosis. All right, diagnosis confirmed. What's next? Well, you've got to put out that fire. So let's talk about treatment. The good news is treatment is usually really effective. It's all about calming down that inflammation. The cornerstone is a high dose of an NSA, something like ibuprofen or aspirin. That's paired up with a second drug called colchicine, which you take for a few months specifically to stop this thing from coming back. And of course, part 3 is just plain old rest, giving your body a chance to heal.
And this chart shows you exactly why that second drug, colchicine, is such a game changer. If you just use NSAIDs alone, there's about a 30% chance it's going to come back. But look what happens when you add colchicine to the mix. Boom! You slice that recurrence rate in half, all the way down to about 15%. That is a huge difference. Now, you might be thinking, what about steroids, like prednisone? Aren't they super powerful anti-inflammatories? And you're right, they are. But here's the catch. They're usually a second choice option. Weirdly enough, even though they can make you feel better fast, studies have shown they actually increase the risk of the pericarditis recurring down the road. So doctors tend to steer clear unless they really have to use them. So once you've gone through an episode and gotten treatment, what's the long-term picture look like? Let's talk about recovery and what you can expect. Okay, the scariest possible long-term problem is something called constrictive pericarditis. That's where the sac gets all scarred and stiff and literally starts squeezing the heart. It sounds awful, I know. But here's the really, really good news. For the vast majority of cases, those viral or idiopathic ones, the risk of that happening is incredibly small. We're talking less than 1%. And really, that brings us to the bottom line. This is a direct quote from our source material at StatPearls, and it says it all. The overall prognosis for acute pericarditis is excellent, with most patients experiencing complete recovery. So despite how scary it feels, the outlook is overwhelmingly positive. So knowing these unique signs, like that sharp pain that shifts when you move, that's powerful stuff. It's a great reminder that our bodies are constantly talking to us, giving us these very specific clues. And it leaves us with a final thought. Now that we know the signs, how can we all get just a little bit better at listening to what our bodies are trying to tell us?